Western North Carolina is home to charming mountain communities, abundant outdoor opportunities, and an exceptional academic health center, UNC Health Sciences at MAHEC, that is committed to training the next generation of healthcare providers to address workforce shortages and improve health across our rural region. Family medicine residents and fellows come from all over the country to grow and learn at MAHEC, training to serve the needs of our underserved and rural populations so they can take their broad-based knowledge and experience to the communities that need them most.
At MAHEC, the purpose of having a family medicine residency is so that we can serve the needs of Western North Carolina. And Western North Carolina is a largely rural part of this state.
I think one of the things that medically that attracted me to the area was some of the challenges that we see, like opioid use disorder is a huge issue here. Other things like other illicit substances like meth is also a huge issue here. So coming from New York City to here, I would be thrown in that world and I would need some sort of guidance. And this is where MAHEC fits nicely in for me because they have all of the resources that I would need living in Murphy and practicing in Murphy.
The Rural Fellowship really is a capstone for the residency experience. So we recognize that the most terrifying year of residency really happens after residency, during the year following graduation. So it builds on what we've taught them in terms of trying to, have full spectrum experiences. We think about this in terms of the 6 Ps. It's essential during that transitional year as they move into practice. The ultimate P is partnership, and that means taking the resources from the region, really enabling them to connect with different people throughout Western North Carolina so that it creates kind of a cohort for life. That's really important for the fellows and the residents to feel like they're part of something bigger and to have a group with whom they continue to grow with outside of residency.
Here, residents and fellows care for patients from a wide range of backgrounds in rural communities across Western North Carolina and the Eastern Band of Cherokee Indians. Rural practice provides numerous opportunities to practice full-scope medicine from pediatric and prenatal care to geriatric medicine and everything in between.
I've been really grateful to find a program like MAHEC and their support of rural health. I think having faculty who really model the full spectrum, practicing like pediatrics, OB, doing a lot of procedures. We learned point-of-care ultrasound. I think seeing that happening with your faculty and knowing that it's possible really gives you the ability to envision a practice that you would want. And then I'm really grateful for all the support that we get through elective time and then continuing medical education and this rural health fellowship we have. So I think it's a great place to pursue rural practice.
I really do love the fact that we work very close to the population where we live amongst all these people and we get to kind of help them intimately. A lot of patients that I deal with on a day-to-day basis. I think that's one of the most rewarding things when you can see somebody that you've helped in the hospital, and you see them walking around and they can say your name and smile at you.
Our residents, fellows, and rural teaching practice faculty have ongoing professional development, research, and mentorship opportunities through their affiliation with UNC Health Sciences at MAHEC.
There's many ways that we can support rural doctors, many opportunities for education of their staff and their faculty here back at sort of the mothership here in Asheville.
The fellowship really helped me ease into practice in that first year, which I think helped it to feel more sustainable, to figure out what works for you and doesn't work for you, to give you a little time and space to think about and adjust things as you're getting acquainted and really have that time and energy to think about how you want to build your practice. And I think I've been reaping the benefits of that since the fellowship. I'm feeling very solid in my practice and with my patient panel, having a good flow in clinic with our nurses and staff. So I'm very grateful for the fellowship.
At MAHEC, we are committed to promoting equity, diversity, and inclusivity in everything we do. We value the perspectives of those who are different from ourselves, and we strive to support all patients with sensitivity, humility, and culturally appropriate care.
when you're working with migrant communities. I think it enhances my skills in terms of cultural sensitivity, working with many different people, many different cultures, many different linguistic styles.
This program is one that offers unique challenges, rigorous learning opportunities, and a group of talented professionals who are committed to improving rural health.
We feel like this is really the model for the future in rural places to develop interprofessional education because communities need it. We don't want our providers to work in silos. We want them to feel supported. And this is a really key part of our educational program, the innovation of future practice in Western North Carolina.
The reality is, in the clinical setting, you have to really have a broad base of knowledge, have a broad base of support, and be able to function at the top of your game. I'm really grateful to the MAHEC Rural Fellowship. It's made my practice more sustainable. It's helped me to be a more confident provider.
We invite you to explore MAHEC's Rural Family Medicine training programs, where full-scope medicine leads to the joy of rural practice and better health.